David Bryden, Director of the Frontline Health Worker Coalition, an alliance of 38 organizations based in the United States. We're dedicated to getting much greater U.S. and global investment in frontline health workers, especially in the low and middle income countries.
I'm Carol Bales, Communications Lead for the Coalition. We've been saying for years that there's no healthcare and no global health security without health workers. Now, with the spotlight shined brightly on health workers throughout the pandemic, we have to move beyond awareness raising and call for our policymakers to act for health workers.
Did you know that 17,000 health workers have died from COVID-19? It's true. In fact, health workers have gone on strike in 84 countries, in many cases due to poor and unsafe working conditions. That's why we're saying that world leaders, including President Biden, when they gather at the G7 and G20 summits this year, must commit to action for frontline health workers. We are also calling on leaders in the U.S. Congress to take on this crisis.
Throughout the year, we've applauded health workers and thanked them for their heroic acts. But as we've heard today from our speakers and health workers around the world, health workers do not have superpowers. They're human beings with talents, aspirations, family, and friends.
Let's talk about specifics. Countries must prioritize health workers to receive a COVID-19 vaccine. They need to plan for the health workers needed to administer the vaccine to all people. Countries must make personal protective equipment available, as well as needed testing and treatments for every health worker, including community health workers. Countries must provide remuneration, as well as additional support and compensation for frontline health workers, including the community health workers. Countries must address the barriers that women health workers are facing in the workplace and open up opportunities for leadership and professional advancement.
One way that you can act now is to join us for World Health Worker Week. It's April 5th through 9th. And tell policymakers to listen to health workers like we've done today. If you're a health worker, join our video campaign. It's at www.frontlinehealthworkers.org. Tell us exactly what you need and why applause is not enough.
Others can help share the videos we collect from health workers and share our policy recommendations. Also, raise your concerns with your policymakers and tell them to increase their budgets for the health workforce. Right now, the Frontline Health Worker Coalition is asking the United States government to provide $100 million in new funding for health workers and health system strengthening.
Thank you so much for being here today and listening. Links are in the chat. Please check them out and let your policymakers know what you think. We leave you now with a powerful message from a health worker in Poland.
Do you think we are heroes? Me and my friends from a variety of medical professions working right now, long hours, short-staffed, without proper personal protection equipment, unable really to see members of our families, only to keep you all safe. It looks good on TV, it looks good on social media, it looks good when all of you support us through different campaigns and performances, but be honest. Did you think of healthcare professionals as heroes 6 months ago? Probably not. And to tell you the truth, we don't need to be heroes. Quality universal healthcare should never be a luxury. It's a human right. Please do think about it after the pandemic is over.